After I just did a video on Bell's palsy, this video is about mini stroke, TIA, transient ischemic attack. You should never ignore TIA. This is the warning sign for a stroke, and definitely see a doctor and get it all checked out. A TIA happens when blood flow to a part of brain is temporarily blocked. Symptoms look like stroke, but they resolve completely within minutes to hours, usually within 24 hours, and they leave no permanent damage. TIA is a medical emergency, though, and it's a strong warning sign that a full stroke may happen soon. So you got to take it very seriously. Common symptoms: symptoms start suddenly and usually last an hour or so. Facial drooping, arm or leg weakness on one side, speech difficulties like slurred speech or unable to speak. Time to act is fast. There could be sudden vision of loss, one or both eyes, dizziness, loss of balance, sudden confusion, numbness, or tingling on one side. Even if the symptoms go away, go to ER immediately. What causes a TIA? Most TIAs are caused by temporary blockage of brain artery. Common causes are blood clots from the heart, atrial fibrillation. I had a patient I saw last week who had a left-sided weakness, facial drooping, and vision loss. And she's known to have atrial fibrillation since 2018, but she has refused to take blood thinner. So it really got her this time. And this time around, she agreed to be on Eliquis, which is a blood thinner. So a blood clot from the heart, like atrial fibrillation, is common cause. Carotid artery narrowing, when you have plaque buildup in your neck arteries. Uncontrolled blood pressure, diabetes, high cholesterol, smoking, obesity, and sedentary lifestyle. How is TIA diagnosed? Even though symptoms resolve, testing is crucial. MRI of the brain got to be done to rule out silent stroke. CT scan should be done in initial emergency room workup, carotid ultrasound, and heart tests like EKG and echocardiogram. Blood test for sugar, cholesterol, and clotting issues. What is the treatment after TIA? The goal is to prevent a stroke. And because of that in mind, that we have to prevent stroke, we use certain medication. Number one is antiplatelets, either aspirin or Plavix, also known as clopidogrel, or other blood thinners. Some people may just go for Eliquis or Xarelto if atrial fibrillation is present. A statin, cholesterol needs to be controlled. Even a smile needs to be controlled, needs to be brought down. Blood pressure medication got to be reviewed and make sure the blood pressure is well controlled, and diabetes control. Procedures, sometimes if there is evidence of carotid narrowing, then patient may need carotid arterectomy or a stenting. And if there's a heart rhythm problem, like atrial fibrillation, that needs to be managed. Lifestyle change is also important. Controlling blood pressure, keeping your A1C and blood sugar in range, and lower LDL cholesterol, stop smoking, exercise 150 minutes per week, eat a Mediterranean style diet, maintain healthy weight, treat sleep apnea if present. Risk of a stroke is usually highest in first 48 hours after TIA. So TIA is not minor, it's a major warning. Early treatment can reduce a stroke by up to 80%. Okay, so understand TIA, and you will definitely be able to help yourself, your friends, or family, or somebody. So thank you for watching.